Today on the Mind Maladies Podcast is Dr. David Smith, a psychiatrist and psychopharmacologist who runs his own private practice. Alongside this, he is also a professor at Stanford University School of Medicine. His main areas of expertise are mood disorders like major depression and bipolar disorder, anxiety disorders, and attention deficit disorder in adult patients. But before diving into the various mental illnesses, I thought I would kick off the second episode of the podcast on a more positive note by discussing the technologies and treatments underway to help treat these mental illnesses. Hello everyone, today we are joined by Dr. Smith. Could you tell us a little about yourself, what you do, where you're from?
Yeah, thank you, Jashan. Thanks for having me on. I'm Dr. David Smith. I'm a psychiatrist, and my area of specialty is called psychopharmacology, which means that I'm a specialist in psychiatric medication. And I have a clinical practice in Palo Alto, and in addition, I'm an adjunct professor over at Stanford Medical School, where I teach about psychiatric illness and psychiatric treatment.
Today, we're going to talk about the technology and medicinal treatment in general of mental illnesses in society today. I'm going to pose this question to Dr. Smith. This is a really broad topic, and there could be a multitude of answers. What are some of the newest innovations in technology and medicinal treatment in recent years?
Yeah, that's a good question. So, I was trying to, because I was anticipating this interview, so I was thinking a little bit about, how broad the subject is. And one of the ways I was thinking about it was that there's kind of like the cheap, accessible end of the spectrum of technology, and then the expensive, high tech, less accessible end of the spectrum. And so, to start with, kind of the less expensive, more accessible end. I think of things like, particularly over the pandemic, there's been a big increase in what's called telemedicine. And again, that's not really a treatment technology, but being able to talk to your doctor or therapist, on Zoom or some the phone or some other video application has really improved and increased the access to care in a way that was unfortunately, that's one of the things about mental health care is that it tends to be pretty accessible in urban places. Like in the Bay Area, there's lots of psychologists, there's lots of psychiatrists, and because psychologists and psychiatrists tend to stay where they train, and so they end up staying in big urban environments. And if you go anywhere outside of the Bay Area, out into the Central Valley or Northern California, it's much, much harder to find a psychiatrist or a therapist. And with telemedicine, it doesn't matter so much because, your doctor, your therapist can be really anywhere in California. So I've been very pleased with, the benefits of telemedicine to expanding care, making care more accessible. And then one other thing I was thinking about, technological advancement that isn't really necessarily based from the pandemic because it was already happening beforehand, but is the way that smartphones, particularly smartphone apps, have proliferated that are geared towards mental health. And of course, I don't think an app is going to replace a doctor or a therapist, but there are things that I recommend a lot, like apps for what's called meditation or mindfulness meditation. That's a well-studied type of technique to help people who are anxious, who have insomnia, who are very stressed. And you can do that on your own. You don't necessarily even need to talk to a therapist because there's good apps that will just kind of guide you through it. And they're not very expensive, and some of them are free. And so that's kind of that less expensive, very accessible to anybody, almost anybody, end of the spectrum. And then we go all the way to the other end of the spectrum. There's some very interesting developments in kind of more high-tech treatments. The one that's kind of emerged in, say, the past 5 to 8 years is, just to give you kind of an example of kind of how technology is helping in psychiatry, is a treatment called transcranial magnetic stimulation, which is a device that delivers a high-potency, focused magnetic stimulation to specific parts of the brain. And you can focus it in on the part of the brain that's underactive with depression, and it helps a lot of people with depression. It's now an FDA-approved treatment for depression. And the current generation of machine seems to be about equally effective to medication for most kind of uncomplicated patients with depression. But there's a lot of research, including over at Stanford, in kind of like next generation higher potency machines that might help patients that don't get better with medication. There's a subgroup of patients that don't get much relief from standard antidepressants. And it'd be very nice to have new treatments that work in different ways that would help them. So that's an example of, it's a little bit more expensive. You need a whole device, you need someone trained in it. So it's not necessarily as easy to access that treatment, although that'll change as time goes on. But it's very exciting to have kind of newer innovations in technology that open up new treatment options for common illnesses like depression.
Yeah. So would you say TMS is similar in the way that ECT works, or electroconvulsive therapy?
Yeah, so that's a good question. So ECT, electroconvulsive therapy, and I will just say that could be a whole interview in and of itself, because that ECT has a long, long history. It's been around since the 1930s, and it actually was before medication. That was the first kind of biological treatment for depression way back in the 1930s. There weren't any antidepressants back then. And ECT has a strong stigma behind it, unfortunately. So I just want to say that it's quite a safe treatment, and it's not scary, doesn't hurt. We don't do it as often because of some side effects, particularly memory trouble. But it's I just want to make a comment that it's still a modern treatment. We still modern ECT is still here. We still recommend it for the right patient, and it's not an old-fashioned treatment. It's still around. But to answer your question, it gets into this category of treatments that are called neurostimulation, where you're one way or another, you're stimulating the brain. Particularly, you're trying to stimulate the part of the brain that's underactive with depression. And there's different ways to do that. So electrical stimulation, again, has been around since 80 plus years now. I guess almost 90 years, goes back to the 1930s. And if of course, you learn in physics that electromagnetism, they're basically the different sides of the same coin. Electrical stimulation and magnetic stimulation are very closely related to each other. And the advantage to the magnetic stimulation is that you can focus it in. With electrical stimulation, you're kind of exposing the entire brain to the electrical stimulation, both the part of the brain where you want it, but the part of the brain that you don't want it. So you end up getting side effects like memory trouble, because the memory parts of the brain, you didn't really need to stimulate them, but they got stimulated anyway, because the electricity, you can't focus. But magnetic stimulation, you can focus very precisely. So it's very closely related to electrical ECT, electrical stimulation, but you don't have a seizure. That's one of the things with ECT. The patients have to actually have a seizure for it to work. They don't have to have a motor seizure. They don't have to convulse, but the brain has to have a seizure. Whereas with TMS, a seizure is not necessary. The patient doesn't need anesthesia. They don't need to be sedated. It doesn't hurt. They don't jerk around. It's a pretty easy treatment to do. And so it's much easier on the patient. And it's not the current generation of TMS treatment isn't as effective as ECT, but again, we're hoping that it will be as technology improves over time.
So with TMS, you said it aims to treat depression and anxiety. So could you go more into depth about TMS and then treatment as a whole?
Yeah. So again, TMS. The idea of TMS was based on the history with ECT, that we knew ECT is. So it still is considered kind of the gold standard as far as the most effective treatment for depression. It's just that it has so many side effects or potential side effects that we don't use it, and except for the most severe, difficult to treat patients, difficult cases of depression. And so there's always been this hope that how could you do ECT or preserve the parts of ECT that are very effective, but reduce or eliminate the side effects? And then people thought of why don't we use magnetic stimulation rather than electrical stimulation
to focus
focus the stimulation specifically where you want it, which will reduce the side effects, because you're not stimulating the part of the brain that doesn't need to be stimulated. And what I guess the point to your listeners is that it's pretty well understood what part of the brain is affected with depression. It's part of the limbic system, which is it's a complex part of the brain that does a bunch of things, but it involves with emotion regulation, and the prefrontal cortex, which is the part of the brain just behind the frontal cortex. The frontal cortex is in the frontal lobes, where just behind your forehead, and just behind that, pre means just before, so before the frontal lobes, kind of in between the limbic system and the frontal lobes is the prefrontal cortex. That part of the brain appears to be underactive with depression. and to try and stimulate neuronal activity and neuronal growth to actually get those neurons to grow and connect with each other. That's pretty much the fundamental goal of all treatment, whether it's with medication or neurostimulation treatments like TMS and ECT. And even psychotherapy has evidence of improving nerve generation, like actually improving connections in neurons in that part of the brain. It's just that we have different ways of doing that. So you can do it with stimulation techniques, you can do it with medication, you can do it with talk therapy. And there's things other than professional treatments that have a similar effect, maybe a little bit milder, but a similar effect, like say like exercise. People who get regular aerobic exercise also have nerve growth in that part of the brain, which can help with the depression symptoms.
Yeah, so you mentioned that the end goal of TMS, ECT is to produce these neurons, the nerves, and the nerve endings. So correct me if I'm wrong, but is the point of that to produce more dopamine to counteract the effect of depression?
That's a good question. So it's a little bit more nuanced. So
okay.
So I'll try and give you the 1 minute version for you and your listeners. All right. So so when you think about antidepressants, all antidepressants work by increasing activity of neurotransmitters. The main ones being for depression is particularly serotonin, but there's two others that are important as well, norepinephrine and dopamine. And so these are chemicals that the nerve cells use to talk to each other. And there's problems with the communication between nerve cells when people have depression. And a lot of it is actually physical, that the nerve cells physically actually withdraw from each other. They're further apart, which means they're going to have a harder time communicating with each other because the signal has to jump that gap, which is called the synapse between the two nerve cells. And when you're increasing neurotransmitter activity with, say, antidepressants, you're helping amplify that communication between the two nerve cells so that they have an easier time communicating with each other, which helps the circuit work better and helps with the symptoms. But the interesting thing about antidepressants is, although they help with that, relatively quickly, it takes a few weeks to kick in, but most people will start feeling better after a few weeks on an antidepressant. It takes a few months for the nerve cells to actually start growing. It's called neurogenesis, where the nerve cells, or neurotrophy, where the endings of the nerve cells actually grow and reconnect. And that's what we think is really the core target for treatments for depression is helping with neurotrophy or neurogenesis. It's not growing new nerve cells per se, it's helping the nerve endings be richer and more dense and more bushy and more well connected with their neighbors. And there's just different ways of doing that. Antidepressants, they increase neurotransmitter activity, which we think creates a cascade effect that leads to neurotrophy. And then these neurostimulation treatments like ECT and TMS, they kind of bypass that. They just kind of go right to the nerve cells themselves and induce changes that hopefully get them to grow and make new connections. And those new connections, when they're healthy, you'll see an uptick in serotonin and dopamine release and norepinephrine release because the nerve cells are healthier and they're communicating better. But it's not that the TMS increases norepinephrine or dopamine or serotonin. What they're doing is they're directly stimulating the cells to fire by using that with TMS, by using that magnetic stimulation, and by consequence then provoke the cells to grow, because the cell that fires and is active is more likely to want to grow and make more connections.
Kind of regressing from the science topic. So you talked about how there's like some on the cheap end of the spectrum and some more expensive. So if and when these treatments become more widespread, do you think that they will be made affordable for people who can't afford them?
Yeah, I hope so. I mean, like TMS, because it is FDA approved as a treatment. So the Federal Food and Drug Administration is the government agency that any treatment, whether it's medication or a device, a surgical device, or in this case, a TMS machine, they have to give data to the FDA that then decides whether the data shows that this treatment is effective compared to placebo and safe. It'll be safe enough, that the benefits outweigh the risks of the treatment for the indication, meaning like for the patients that you would use the treatment for. And the reason I explain that is because if the FDA has approved it, then insurance companies are more likely to actually cover it. And most insurance companies do cover TMS now. It's which is good. I mean, you still, depending on your insurance, you might have to pay some out-of-pocket expense, but you don't have to pay the full fee, as long as you have insurance. And most insurances do pay for it. Even like government insurance, like Medicare, pays for TMS if the person is a proper candidate for it. And the main sticking point right now is that is access. That people, the machines are mostly available either at academic centers like Stanford, or there are people in private practice that that have a clinic with TMS, that have able to provide TMS. But again, like I was mentioning before, that these are things that unfortunately are very concentrated to urban environments. You have to be in the Bay Area or Los Angeles, or New York or Chicago. Some big city is going to have, there's going to be a TMS provider. But you get outside of big cities, and it just hasn't trickled out to less urban environments yet. And that's a function of the training. There needs to be people out there who are interested in getting trained for it, and then to be able to have the machine, get the machine available in their clinics so that people can start using it.
So I think you mentioned that for now, ECT remains more effective than TMS. Is that correct? So how do both of those compare to other antidepressants like SSRI?
Yeah. So that's a good question. So current generation of TMS is about equal to antidepressants, including the standard SSRI antidepressants. And depending on which study you're looking at, and what type of depression, that's around 65% of patients with kind of first onset moderate depression or moderate to severe depression will respond to antidepressants or TMS. Whereas with ECT, the response rate for that kind of depression is closer to 90%, which is very high. It's just that most patients with that first onset, you're not going to choose to do ECT because a lot of patients are going to do just fine with a more less intense treatment. So you're going to start with one of the less intense treatments than something like ECT. There's a subcategory of depression called treatment refractory depression. Refractory means something that's not improving, that's stubborn. And so treatment refractory depression means that someone has already tried several treatments. They've tried 2 or 3 antidepressants, usually more than one antidepressant in different classes. They may have also tried other treatments and other than antidepressants. Maybe they've already tried TMS. And in patients who have treatment refractory depression, then the response rate, you still are going to try and treat them, but adding another, trying another antidepressant, the response rate starts to get much less. The response rate, is like 20%, 25% rather than that 60 to 70% response rate. And that's still where you see a big benefit to electroconvulsive therapy, even for people who've tried 8 or 10 antidepressants, they haven't responded at all to antidepressants. It's not 90%, but it's still over 50% of patients in that category who try ECT will get some significant relief. And TMS is not at that level. TMS is more in line with antidepressants at this point. But we're excited about new generation, kind of next generation machines that are higher intensity or higher frequency machines that might be able to bridge that gap, that get closer to ECT level of effectiveness.
Yeah, kind of relating to that, what do you anticipate the long-term effects of these treatments will be, maybe in from like 10 to 20 years from now?
Yeah, so I hope that TMS is more widely available, particularly and that the machine is the next generation of machines are more effective. I think you'll see a balance at that point of like some patients will use medication, some patients will use TMS maybe even before medication because it'll be much easier to access it. Right now, the vast majority of people who do TMS have already tried medication, just because it's harder to find people that do TMS, and so it's much easier to find help with medication. So people usually do medication first and then TMS if medications don't work. And I think that balance will probably change, that it'll be easier just to go do TMS and instead of, if someone doesn't want to try medication, they could just do that instead. And hopefully that the next generation of machines will be out, and that'll be nice to have a even more effective, kind of faster treatment. It'll be interesting to see whether that translates into anything that's more consumer available, meaning like someone could just treat themselves. You wouldn't necessarily even need to go to a doctor's office. I mean, that's something I've thought about. I don't know if it's just my own thinking that would be kind of cool. I mean, the reason you don't see like antidepressants like available over the counter is because they're not that hard to use, but there's enough potential problem with side effects or overdose or interactions that you just you need to have somebody who's well trained to prescribe them, as opposed to just like say going to get like Tylenol or Motrin, where you can just go get that yourself. And I wonder if maybe down the road, I don't think 10 years, but maybe 20 or 30 years down the road, that might be something you could just go buy the machine and have it at home, and that people will be able to give themselves their own magnetic stimulation with some device.
Totally.
That'd be consumer friendly. That'd be I don't know if that's ever going to happen, but that maybe science fiction, but maybe 20 or 30 years from now, you could treat your own depression.
Adding on to that, so do you think these new technologies will affect the role of healthcare workers in and outside the hospital negatively or positively?
Oh, I hope positively. I mean, the better the treatment, the better it is for everybody, including providers. I'm always, I tell patients, I one of the reasons I do my job is because I really like to meet people and I like to help people. And, so I'm doing both. I'm meeting a lot of people, and hopefully most of my patients get better, and, so I'm helping people. But I tell patients, one of the things, that I always look, that I'm very happy with is when you graduate. If you've done well and you don't need treatment anymore, and you're able to, move on, and, you graduate from treatment, that's terrific, and it just means that, there's more space for somebody else who is waiting, And so if treatments get better and more accessible, then we have more time to help the people that are the subset of more complicated patients. And, the patients that, have more, straightforward or easier to treat symptoms, they can be treated easier, and they don't need quite as high level of care as they do now, which means that in my field in mental health, we'll have more time to spend with the more complicated cases that need more help.
Totally. You mentioned there's a stigma surrounding ECT because of the potential side effects with memory and whatnot. So for a person that maybe would want to avoid these more expensive treatments because of the stigma or whatnot, you mentioned that there are apps on your smartphone that you can do at home to maybe feel better about yourself, be more positive. So I think that's a great way that someone, even if they can't afford these treatments, they can still try to help themselves in the best way possible.
Yeah, at least to get started, know, and these are things that I think are helpful for everybody. The technical term for the meditation type thing is called mindfulness-based stress reduction, or MBSR, is the type of meditation that's been well studied. There's actually academic studies about MBSR, mindfulness-based stress reduction, and that they help just about anybody. You don't have to have a diagnosis of depression or anxiety. People tend to sleep better, their blood pressure tends to be better, they tend to be less anxious. We all have stress. If you're a student, you've got some stress. If you're a parent, you've got some stress. If you've got a job, you've got some stress sometimes. And helping people better handle stress is one of the most important things for reducing the risk of actual illness. Reducing risk of anxiety disorders and depression is helping people better manage stress. And a lot of it is lifestyle. Like helping people exercise, knowing the value of exercise, knowing the value of good nutrition, getting enough sleep, not sleep depriving themselves. So that's just kind of lifestyle stuff. And then some of these apps that focus in on stress reduction, like mindfulness-based stress reduction, everybody could benefit from that. You don't have to be a patient to benefit from those kinds of help.
So now that we've reached the end of the episode, I always ask something about how maybe we can combat the stigma surrounding these treatments, medicinal treatments too. Because right now, as you said, there is stigma surrounding the ECT because people are scared of doing it.
Yeah, well, I think the stigma, just a quick comment, is the stigma with ECT goes, unfortunately, I think really stems from a combination of media portrayal.
Yeah.
There's a very famous movie that's old now called One Flew Over the Cuckoo's Nest, that shows ECT being done in a very barbaric, way with no anesthesia and basically in a punitive way. Like they were angry at this patient, so they decided to do a shock therapy with him, and it was, that's completely unethical and not something that is anything like what ECT should or is done. And so, but people still, even people who've never seen that movie, have that image in their head of like someone being strapped down and held down and
with like the thing on their head.
Yeah, it's like it makes it seem like torture. Okay, and that's not at all what actual ECT is like. So that's kind of a unfortunate case of kind of the media, making people for generations afraid of ECT. Like whenever I bring it up with a patient, I always have to explain right away that it's not like that movie, because that's what people think. If they don't know, that's what they think it's like. So that's unfortunately very specific to ECT. Makes people very scared of it. And as I said, it's not like that at all. But treatment in general, my feedback would be that these are all tools. Okay, TMS, antidepressants, ECT, they're tools. And just like a tool, like if you have, your garage and you've got a bunch of tools in your garage, if you're doing a project, you want to get the right tool for the project. A certain tool may not be necessary for this project, but the right tool, you use it. And then when you don't need it anymore, you put it away. And that's the way I like to think about psychiatric treatment. If you've got a problem where this is going to be a helpful tool to help improve that problem, then there's no shame in getting access to it. And when you don't need it anymore, we'll put it back in the toolbox.
Yeah.
And that's my metaphor that I try to reduce, that I try to help people reduce the stigma around psychiatric treatment.
Yeah, kind of giving my own thoughts on this. I think that like the media plays a large role in encouraging the stigma. So I think a big part of it is like educating the public that a lot of what we see on the media isn't true.
Yeah, or it's distorted, or
100%.
It's because there's it's a show. If it's a fictional show, they're going to amplify or distort something for the sake of what they're trying to say in the show.
Yeah.
But that unfortunately can give people the wrong impression about what actually psychiatry and psychology are like.
Yeah, that's about all I have for you today, Dr. Smith. I'd like to thank you for coming on the podcast and speaking to me about this. Thank you for your time.
You're welcome. It's been my pleasure.
Thank you guys for listening. Make sure you check out the link in the description to the Mind Maladies website. See you guys in the next episode.